Hi YouTube. So we are just busy getting ready. We leave tomorrow for our first third-year rotation. And I am so excited and running around like crazy trying to get everything done. But I thought before I pack up all our books, I'll show you guys what we're using to study. And I probably overbought books like I normally do because I love books and have a book problem. But I'll just show you and then maybe I can give feedback at the end. But first book I got was The Wards, the first aid for the wards. And I just got this I know it's not completely comprehensive, obviously, for studying for boards or anything like that, but it has most of our required rotations as topics. So the first one's emergency medicine, and that's my first rotation. And it's just kind of cool. I really like it. It has like tips and things to expect and how like an emergency room is run and different procedures. And then what I love is like they have a little section that says what should I carry in my pockets, and it goes through that and high yield clinical checklist of topics. So tomorrow I will read through all of those. There's only like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 of them or so. I don't know if you can see that, but and then they go into like common things you'll see in the ER. So anaphylaxis is one, angina is another, acute myocardial infarction. Anyway, so it goes through like your basics, and then it just talks about signs and symptoms, differential workup treatment for each of the things. So kind of really handy. My goal is to get through just the whole emergency medicine chapter tomorrow before I start my rotation, just so the big things are fresh in my mind, and hopefully I'll be able to answer at least one question right on my first day. But so with this book, I'll just read. I probably won't bring this with me, but I'll read it like each weekend before the new rotation starts to get me thinking and prepared for the next rotation. Then, let's see, where do I want to start? Okay, I guess my preceptor has already emailed me and told me kind of what's expected of me and the different books and different required things. And a textbook, so certain things are required out of the Tintinelli's emergency medicine textbook, and it's really expensive, and she said please don't buy it, but she has a 7th edition copy in her office, and then also we have access to it online through DMU, which is awesome. And so I didn't buy it, but I did still want like a basic text so I could go home at night and read up on something more in depth than just like a review book. So I have this book, and I just tagged all the high yield topics that I'll probably read over. Then the other books that were required, or she said, and I think she has these on loan too, but I wanted to get my own EKG, a rapid interpretation of EKGs. I already have an EKG book, so I probably don't need another one. But I really liked how this one was laid out. It's kind of like quiz format, and so that's something I can definitely do while like in the ER. Because I should talk a little bit about my rotation, I am in a small town, and it has, I think it's called like a low volume ER. She says that they average less than 1 patient an hour, so you'll get a lot of your work done in the ER. But a positive thing about a smaller ER like that is that you get to do pretty much everything. You'll see the patient from when they walk in, you'll get to register them, and then bring them over and triage and get their vitals, and then bring them through the emergency room and take their history and do their physical, and then we'll go and get our preceptor, and she'll come in with us. Obviously, I think on the first day or two, she'll walk through everything with us, and I'm the only student, which is great too, because then I get to see everything and hopefully do a lot of things. And then the other book she wanted us to read was this chest, I don't even know how to say that, Rowan genealogy, Rowan? I don't know. It's like chest x-rays. And so I got this from our library. It's from 1999, so hopefully it's all still relevant. But again, it's kind of the quiz format. The glare is kind of bad, but that'll be good. So I'm just going to kind of work my way through this in the next 4 weeks. So let's see. Other books that she said we should have in our pocket is a little Pharmacopoeia 2012 edition. Then Sanford's Antimicrobial Guide, which I'm gonna need to get bifocals because I don't know how I'm gonna read all that. And so those were things that she had said, and also like a pregnancy wheel and your stethoscope, and make sure you wear your white coat. And I think that's all. Then on my own, I bought this book. Oops. 5-minute osteopathic manipulative medicine consult, and it's really cool. So I really hope that I don't lose my skills that I've learned over the last 2 years. And this book, I think, will hopefully help me say, okay, if I have 2 minutes, I hopefully can treat this patient. So, like, for example, one of them is Bell's palsy. Oops. Okay, so you really can't see it. But it just talks about a parasympathetic, sympathetics, motor, other things. And it has a treatment side. So if you have 2 minutes, do the gull breath technique. If you have 5 minutes, do that plus the cranial dysfunction. So do cranial and extended treatment. It has a whole list of things. Carpal tunnel syndrome is another one. And again, it breaks it down to if you have 2 minutes, here's a treatment. Do the flexor retinaculum treatment for that one. 5 minutes, you can do the upper extremity, carpal bone, and the HVLA for thoracics. So I don't know, we don't have to do any of it, but it gives you kind of quick ideas on, what or how you can help them. And then they also have specialized tests, just kind of reminds you, Allen's test and Finkelstein's test. It's like my favorite name. And then summary charts, so different dermatomes, reflexes, nerve roots, all those lovely things. Different cranial diagnosis, how your hands move, which will be helpful because I feel like I've forgotten that a lot already. Sacral dysfunction, little chart. Ugh, glitter's bad, but anyways, I'm excited. I hope I get to use this. The first physician I'm following is a DO, and I hear she's big on like osteopathic principles and everything, so maybe even in the ER I'll get to use this. Then I have a little pocketbook. I think Maxwell's was another recommended one, and this is right next to it, and it's a little bit thicker. There's more pages. And it's the DO pocketbook. There's an MD one too, and I think the only difference really, they have like an osteopathic section in here that talks about treatments and osteopathic exam, Chapman's reflexes, so the MDs wouldn't have that, I don't think. And they have like cranial nerves, dermatomes, different orders, so post-op notes, admission orders, so progress notes, fluids, pediatrics, so immunizations, newborn reflexes, APGAR scores. So just as like a quick reference. Oh, like ACLS is also here in the back. What else? Nerves, EKGs, reading them, lab levels. Anyways, that's cool. I turn on the back. So this will hopefully be in my pocket and maybe hopefully will be used as a memory tool. And then I just bought a little notebook. It's just plain lined paper. So hopefully if I need to take patient history down, or I should read up on this tonight, I'll have this to write it down and remember. So, and then I forgot this book, my favorite book. So this one wasn't required, but I love the case file series. I think I have one for every single rotation. I bought these last year and it really helped out prepare me for, my SPALs and simulation, where we went and would see a patient. It just walks you through cases, obviously, and so here it starts off with a case, paragraph long, and then it'll ask you like, what are the next steps? What treatments should be instituted? And then it walks through. So like this one was anaphylaxis and causal considerations, pathophysiologies, diagnosis, treatment. Then it has like multiple choice questions at the end. There's like 4 of them. So I think there's 50 cases in this book, and I'm really excited to use this. So my goal will be just to read a few cases a night, or maybe if I see a patient, I'll read up on it in here, but I might be using my laying book too. So, and then also my 3-ring binder. I was going to mention my favorite 3-ring binders because I'm that nerdy and have a favorite 3-ring binder, but they're by In Place, the heavy-duty view ones. I get them at Office Max, and I love them because, I don't know if you can see this, it just has a flip like that. You can just do it with one hand, so easy. And also has the slants here, so that's where all the paper's all down. And I don't know, I really like it. It has the 2, you're seeing it upside down, but it has the 2 pockets there. And in these, we each printed off our clinical rotation rules and requirements, class of 2014. I don't know, just it's kind of like the handbook and different things you have to look at to make sure you're doing, and it has important names and numbers and emails in here. And then also we'll print off, or I already have printed off, I should put in here, the syllabus for the rotation and what's required of us. And then we can keep like my immunizations up here just in case anyone asks, and just different things. And then as I'm going through and I do the objectives for ER, so like some of them were probably like acute MI and aortic dissection and ectopic pregnancy. Those are just different topics on our objectives. I'll type them up, and maybe I'll do like signs and symptoms and differential and maybe things to look for, physical exam, how to, management of it and treatments, follow-up. And so I'll just jot all that down and keep it all in my 3-ring binder. So we each have one of those. And I guess since I'm doing that, so that's all my rotation on ER. And not to confuse things even more, I'll show you guys John's book pile for OB-GYN. Okay, so I already showed you kind of our basic. We have kind of the same, so he has the OMM little guidebook, or the little treatment book, and Sanford's, and the pharmacopoeia, the notebook, and all that. He has all the same things for that. But he also has a little handbook for OB-GYN. This one's by Dr. ZHENG. Anyways, this one was highly recommended, and so was the, obstetrics, gynecology, and infertility, I think it's called. And I just looked at them both, and I like this one more. So it'll be good for him to have it in his pocket in case maybe after a surgery or something he has some downtime, or if they're waiting on a delivery or something, he can just have that in his pocket. And if he's wearing scrubs or something, that's easy too. And then again, I have the case file. Oh, the glare is terrible, but this is the case files for OB-GYN. Same idea as the emergency medicine one. This is the blueprints. This is the one that was recommended. Well, this was like gold pretty much from what I've read. And the doctor that he'll be with actually said for sure get this book, and they'll talk through it on the last day of the preceptorship or the rotation, and then he'll take the test. And so anyway, it's just kind of a review book. I wouldn't call it like, obviously it's not that thick, it's not a textbook, but it has all the big things, and it goes through signs and symptoms, differential treatment, things to look for, etc. Great book. I've already read it once for OB-GYN, and I love OB-GYN, so I read it. Then this is what we call our Beckman text. It's OB-GYN. We just bought this one, and I love it. I think I should be on my OB-GYN rotation because I've already read a few chapters out of here. But I don't know. It's just, this will be like our textbook, kind of like my Lang current diagnosis and treatment for emergency medicine. This will be one that maybe he won't read cover to cover, but he'll be able to look up something if he wants more in depth of fetal growth abnormalities, IGR, and macrosomia. So, and then he also has a 3-ring binder with the handbook thing and the objectives and syllabi and all that. So, again, we probably have way too many books, but it's our first rotation, so we really don't know what to expect. So I'm going to go continue packing, and that's our book list for our first rotation. So again, for me, I'm doing emergency medicine for the first 4 weeks, and John's doing OB-GYN. So